According to the WHO, 2 key reasons to get vaccinated are to protect ourselves and those around us. Successful vaccination programs depend on the cooperation of every individual to ensure the well-being of all. We should not rely on people around us to stop the spread of disease. We too must do what we can do.
Babies are born with some protection against diseases already. However, they're not strong enough to fight off all the diseases on their own. This is where vaccines come into play. According to the CDC, today's vaccines can protect children from more diseases using fewer antigens, which are parts of the germs that can cause the body's immune system to go to work. California now requires all children to have been vaccinated before enrolling into kindergarten. Governor Jerry Brown passed a law that closed the loophole for vaccinations that went into effect July 2016. Just ask the doctor who decided to do otherwise.
A controversial Orange County doctor who opposes the state's mandatory vaccination law could lose his license for letting a toddler skip his shot.
Here are some parents' concerns about vaccinating their child.
Jenny McCarthy claimed that vaccinations gave her son autism, Alicia Silverstone calls the vaccine calendar a shoot-'em-up schedule, and Donald Trump argues today's dosages are meant for a horse.
Got very, very sick, now is autistic.
Let's see how that might have turned out.
If you are not vaccinated and you come in contact with someone who has measles, you got about a 90% chance of getting it.
In 2014, this drop in vaccination rates contributed to an outbreak of measles at Disneyland, which quickly spread to other states the following year.
There has been no link between autism and vaccinations. There was a 1998 study which raised concerns about a possible link between the measles, mumps, rubella, MMR vaccine, and autism, which was later found to be seriously flawed and fraudulent. The paper was subsequently retracted by the journal that published it. Unfortunately, its publication set off a panic that led to dropping immunization rates and subsequent outbreaks of these diseases. There is no evidence of a link between the MMR vaccine and autism or autistic disorders. Actually, the man who published this had his medical license revoked. Did we mention it doesn't cause autism?
Did we mention it doesn't cause autism? Did we mention it doesn't cause autism? Did we mention it doesn't cause autism?
Even the Autism Speaks advocacy group has released a statement that all children should be vaccinated. If we stop vaccination, deadly diseases will return.
People have become reliant upon others having vaccinations as a way of protecting their own health. This is called herd immunity. When enough people are vaccinated against a certain disease, the germs can't travel as easily from person to person, and the entire community is less likely to get the disease. Even if someone did get sick, the disease wouldn't be able to affect as many people. Eventually, the disease will become rare, and sometimes it's even wiped out altogether. For example, the measles vaccine was released in 1963, and by the year 2000, it was declared eliminated because there had been no new cases in a 12-month period. However, because not everyone is vaccinating their children, the measles came back. And in 2014, there were 668 new cases of the measles.
Vaccinations are important because no single preventative health intervention is more cost-effective than immunization. The cost of vaccination would be much less than the cost of hospital bills if one were to develop the disease or death. It prevents 2 to 3 million deaths every year and has already eradicated smallpox and is now closer than ever to eradicating polio.
Vaccinations are great for your health, but also for the health of the people around you. So vaccinate your kids and get your boosters.